Okay, we're going to go ahead and get started. My name is Ashley Thomas. I'm the clinical program director at Evolve Woodland Hills Residential Treatment Center location. I'm going to start with sharing a little bit of information about Evolve. And then we'll get into our presentation on understanding trauma in teens after that. So first, a little bit about who we are at Evolve. We are an adolescent treatment program. We treat adolescents 12 to 17 years old who are struggling with a variety of conditions you can see here, as well as trauma, of course, which we'll be talking about this afternoon. We have a continuum of care, including residential treatment, which of course is in our both Northern California and Southern California. We have a number of facilities, and our teens usually stay in the RTC for approximately 30 to 60 days. And then we have community-based partial hospitalization program, which is a Monday through Friday day program, a step down from residential, and then intensive outpatient program, which is paired with our PHP. Those work together. And intensive outpatient is usually 3 to 4 days a week for part of the day. At Evolve, we use a lot of dialectical behavior therapy, and I'll talk a little bit about that today and how it relates to trauma treatment, as well as cognitive behavior therapy. We have a structured schedule in all of our programs with group therapy throughout the day. We also, of course, provide family therapy and experiential therapies. For example, at my program, we do equine therapy. The teens are actually there right now, as well as surf therapy, mindfulness outings, and things like that. So a lot of hands-on way to heal and also to apply the skills that they're learning. Okay. So like I said, if you have questions about Evolve, Kara would be more than happy to answer those for you. And I'm going to speak a little bit from my knowledge and experience related to treating trauma in children and teens and working with families. As I mentioned, I'm the clinical program director at Evolve Woodland Hills residential location. And I'm also a certified trauma-focused cognitive behavior therapist. So I have experience with that. And I spent a lot of time since graduate school and in the years since studying and working with trauma. So it's definitely an area of interest with mine that I chose to share with everyone here this evening. So first of all, I think this is an important place to start. What is trauma? So I have here some kind of different meanings and definitions about what trauma is. Often in the medical world, you'll hear about trauma as an injury, right? And we can think about trauma as both the event and the impact of the event. So you'll see some kind of explanations here. The emotional response to a terrible distressing event, or the response to a disturbing event that overwhelms an ability to cope. And again, the impact, right, resulting from exposure to an incident or series of events that may be disturbing or life-threatening and have adverse effects on one's functioning and mental, physical, social, emotional, and or spiritual well-being. So we can see that, trauma can have an impact really in kind of all areas of the self. And we can also think about trauma as the event, and we'll get into that. So types of trauma or traumatic events is really like a wide range. And we can think of, in kind of a simpler way, as a trauma as anything that's like deeply disturbing to you as a person, or caused you a lot of fear or distress. Clinically, we look at these types of events here specifically. So it could be a singular event, meaning it happened one time. So an incident of abuse, perhaps that happened one time, or a natural disaster, a medical trauma, or exposure to maybe like a violent event in one's home or community, or even kind of a more removed exposure, like in the news, like hearing about a community event or something like that. And then there can also be traumas that kind of are like multiple events or keep recurring over time, or like we have multiple types of events that we've experienced. And so here's some examples of those. And we could also experience a combination of, say, for example, ongoing events. Maybe we've experienced, for example, ongoing bullying throughout childhood. And then we've also experienced a medical trauma. COVID would be a great example of this, whether we, had a COVID diagnosis, became ill from COVID, or lost a loved one suddenly to COVID. This could be a traumatic event for us, depending on how we experience it. Now, this slide here, I'm going to talk about like how trauma impacts us as people, and we're of course specifically thinking about teens, so we'll hone in on that. Underlying all trauma is a loss of sense of safety and an impact to the sense of self and to one's relationships. So I like to think of it, I have this visual here for you because I like to think of trauma and the traumatic impact as like a balance between the level of stress of an event and the level of coping or safety that one has in their life. So we could also think of this as like risk and protective factors. So it's kind of this balance of these. So for example, if the event is highly stressful and we have low coping skills or a low sense of safety kind of at our baseline, then that means that there's going to be a higher trauma impact. This is kind of like the formula that I've come up with. And then if we have, for example, a low stress event, like something that was scary, but maybe was not a hugely traumatic event, and we have a good sense of safety, a good support system, and strong coping skills, then it's likely that that traumatic event is not going to have a strong impact on us. So like we're not going to have the adverse effects that we might see otherwise. So those would be kind of the ends of the spectrum. And then there's everything in between. Now, when we think about teens, in particular, children and teens, they often haven't developed a wide range of coping skills yet. So this is important because if they don't have that strong sense of safety, or they haven't developed a lot of coping skills yet, the teens are beginning to adventure out in the world on their own. It's kind of this uncharted territory. And then they either have been experiencing during childhood kind of ongoing negative events, or they experience something that's really impactful, then that could overwhelm their ability to cope with that event. And when we see that the event or the stress of the event or events overwhelms the ability to cope, that's when we see some of the negative impacts. Some of the other factors that go into kind of like the extent of the impact, or like what contributes to the traumatic impact, might be like past personal or family or community experiences. Like, what are my past experiences leading up to this event that I'm experiencing now? Also, what's the duration of the event or stressor that I'm experiencing? So that kind of goes back to like, is it a one-time thing, or is it multiple times, like a repeated event? Is it short-term or is it long-term? Also, like the level of exposure. So one thing is to like directly experience something myself, and then there's like levels of exposure versus, let's say, my parent has experienced something traumatic and I'm feeling the impact of that through them. Or a cousin has experienced something, or I'm hearing about something on the news that happened in my community. So there's these levels of impact that can contribute to this as well. And then the resources that we have to recover from a trauma or a crisis. So I'm going to get into a little bit about protective factors, but these can be lots of things. So going back to the coping skills, and then the safety resources, so support systems, spiritual support, school, family support, things like that, as well as things like financial and material resources, access to healthcare, mental health care. All of these things can play a role. So when we think about what kind of creates a buffer or a protective layer when that trauma hits us, these are some of the things. So these are protective factors. So safe environments. So environments is like a very general word, but that might be our physical environment, our home, our school, our community, just how safe we feel in those settings, as well as like the emotional safety of those environments as well. What's kind of the climate? Am I safe to express myself? Am I safe to be who I am? Am I safe to, speak what's on my mind? Things like this. The family environment. So a supportive family environment is a protective factor. And this is like all the relationships within the family. So this is the parent-child relationship. This is the relationship that a teen has with siblings. This is the relationship that a teen has with extended family members, and the relationship that maybe the immediate family unit has with extended family. So what is the support like within the family system? Nurturing parenting skills, stable family relationships, household structure. So structure can be a protective factor prior to trauma as well as after a trauma. So having kind of a predictable, structured environment within the home, with rules, supervision, predictable kind of consequences, positive and negative, of certain behaviors and things like that. Adequate housing and financial resources, of course. If we don't have stable housing, or we're not in a stable financial situation, then that creates primarily often stress for caregivers, which can then also be transmitted to children and teens, or they might be feeling the impact of that directly themselves as well. As I mentioned before, also access to healthcare and social services. If we have access to healthcare, therapists, things like this, then we're taking care of ourselves, and we're less likely to be negatively impacted by a trauma. Similarly, like if and when it does happen, which it does because we all experience trauma, if we have easy access to that kind of assistance, then that's going to help us as well. And then caring adults outside of the family who can serve as role models or mentors. This is something that we know for teenagers and children and teens is a protective factor already. It's something that helps them in their development, and certainly with trauma as well. And then communities that support parents and take responsibility for preventing abuse. So the way that the community, whether again that be a religious community, a cultural community, a school, a neighborhood, on the national level, whatever that may be, the way that they respond to, say, abuse, crises, traumas, really plays a role in how that impacts children and teens as well. Okay, so flipping that over a little bit, these are some things that we would want to keep an eye out for. I like to call these warning signs. And you may know that your teen has experienced a trauma, or you may not know that your teen has experienced a trauma, and you may be seeing some of these signs. So these are signs that should get us curious, I'll say. So we have increased fear or anxiety. Could be related to certain people, places, or things in particular, or it could be just kind of a general state of being. Agitation, withdrawal, so kind of pulling away, maybe pulling away from family, pulling away from normal activities, pulling away from school, maybe spending more time in their room, on their phone, things like this. Sudden changes of behavior. Any kind of sudden changes of behavior would be a warning sign for mental health generally, as well as for trauma. Especially things like sleep, eating, hygiene, changes in friendships, relationships, things like that. And substance use, of course, and other risky behaviors, such as the ones mentioned here. So, as you can see, some of these warning signs might be kind of resulting from the distress of the trauma. And some of them also are an attempt to kind of cope with what's going on internally. So sometimes with substance use and the risky behaviors, really what that is an attempt to deal with what I'm feeling and what I'm experiencing. And of course, that's something that we want to address early on so that it doesn't become kind of like a reinforced pattern of dealing with things. With all of this said, if you're seeing these things in your teen, let's not jump to, oh my gosh, they've experienced a trauma and this is what's going on. But like I said, this is an invitation to get curious. And there could be other things going on. However, from my experience, I would say that something that I've often seen is that sometimes trauma gets, I want to say disguised, but it sort of gets missed and often will be identified as within the realms of depression, other types of anxiety, maybe as substance use as the only issue, or ADHD even. Because the nature of trauma is that when we experience it, we don't want to talk about it, we want to avoid it, and we want to numb it. Often, the teen is not, or anybody is not going to walk in and say, I've experienced this trauma and I think it's impacting me in XYZ ways. Often you'll see the symptoms, which can appear very similar to other mental health issues. And we only find out through maybe a caregiver or through a course of treatment, oh, this teen has experienced some significant events that might be playing in here. So as a trauma therapist, this is something I always have my eye on and I'm always asking questions about. As a parent, I think if you're seeing these things, it's an opportunity to maybe get curious and talk to your teen or talk to a provider about your concerns. So we'll get into kind of clinical land here for just a second. So one of the things I've noticed over the last few years, I don't know if anyone else has noticed this as well, but trauma and PTSD have kind of become buzzwords. And I think this is for a few reasons. One is because I think we have had some progress in terms of reducing stigma around these issues. And so we've also had studies like the ACE study, Adverse Childhood Experiences. Thank goodness for YouTube and TED Talks and Google. There's a lot of information out there. And so I think that has contributed to people learning more and there being less stigma. People do feel more comfortable openly discussing these things to some extent. And I think at other times, some of these terms get misused. And, maybe I had kind of an adverse experience, but I don't have clinical symptoms of a trauma response, and yet I'm saying, oh, I have PTSD from this one thing. And so it can get thrown around, which can also have a detrimental impact on people who are actually experiencing these challenges. So I want to clarify, the reason I bring that up is because I want to clarify, like, what does it actually mean when we talk about PTSD? This note at the top of this slide, I think, is really important. So studies show that about 15 to 43% of girls and 14 to 43% of boys go through at least one trauma. So one of those really significant events that we're looking at with PTSD. So like abuse, intense violence, medical trauma, natural disasters, wartime violence, things like this. Of those children and teens who have had a trauma, 13 to 15% of girls and 1 to 6% of boys develop PTSD. Okay, so that's pretty low if you look at the big picture. Now, children who have experienced adverse childhood experiences, most of us have experienced at least one. I'm not going to cover that today. It's a whole topic in its own, but if you're interested in that, write that down, check it out. Some very interesting studies and follow-ups that have been done around that. So we've all kind of experienced some adverse events for sure. But in terms of like who's actually developing PTSD, especially thinking about children and teens, it's a small number. And you can think back to those protective factors and things that protect us even when we do experience these events too. Okay, so what does this look like? So there's two diagnoses specifically that come up the most when we're talking about trauma. So we have acute stress disorder and we have post-traumatic stress disorder. What this looks like for both is very similar. So we have these four categories that you see here. Intrusion, which means that I have unwanted and like uninvited memories, dreams, and flashbacks, thoughts, visuals, things like that as well. And then I also have avoidance. So I avoid memories, thoughts, feelings, people, places, conversations, anything that kind of reminds me of or is associated with the event. And then changes in mood. So things like irritability, anger, sadness, numbness, and arousal. I'll explain a little bit about how this works, just kind of from a brain perspective. But things like being hyper-aroused, so like hypervigilance, always watching your back, being very jumpy, things like that. Difficulty concentrating, difficulty sleeping. These symptoms, so we have to have symptoms in all of these areas, and they're causing impairment in important areas of functioning. So things like school, work, family relationships. And here's the difference between the acute stress and the PTSD. So acute stress are symptoms that last for up to 1 month after the trauma. So a good example that like many of us have experienced is like a car accident. Often if you've been in a collision, you may experience some of these symptoms in the days or weeks following that event. You may find yourself having kind of dreams about that kind of experience, kind of feeling more stressed out, not wanting to think about it, maybe not wanting to drive or get in a car. And then when you are feeling kind of on edge. So that's kind of a common experience, and that might be like an acute stress situation. And usually for most people, that goes away after a few weeks. So we would have acute stress, but after 1 month, there's no significant kind of signs or symptoms of that anymore. When those signs and symptoms persist for more than 1 month, that's when we are looking at a PTSD situation and diagnosis. So what that means is that if we kind of think back to the earlier slides, is that this event has really overwhelmed our system. And our brain, our body isn't knowing how to cope with this. We don't feel safe. We don't know how to kind of recover. And so it's kind of really staying stuck in us. And it's lasted more than a month. So this could mean months, this could mean years. Hopefully, not years, but sometimes this happens. We've experienced something earlier in life and it hasn't been addressed, and it kind of lingers there. So with teens, we have an opportunity to identify that and intervene. So that's kind of the difference there. And then also, like, lower level is something we call an adjustment disorder. So there might be some stressors going on, like some adverse events, and those have caused some of these symptoms and are causing some impairment, but not to this level. So these here are things that we might see in our teens at Evolve. We might see these acute stress disorder or PTSD going on. This graphic here, I just really love this because it kind of gives like a really good description of all of the kind of losses and impacts that can be involved with trauma, and some of the sort of symptoms that we can see. So another symptom might be reenacting. We try to, in different ways, like in younger children, it's often through play. In older children, teens, and adults, we often will actually like kind of try and reenact a situation, like a relationship or different situations, trying to kind of get a different result. We're like really resilient. We're trying to heal ourselves, but we're kind of often going in the wrong direction. And then we have a lot of losses, right? So kind of loss of my sense of self-worth, loss of my sense of self, like I kind of become disconnected from who I am, my identity. Down here, you see the loss of connection to body and dissociation. So it's like literally a feeling of being disconnected. Loss of intimacy, particularly when we've experienced physical or sexual abuse. It can be hard to connect emotionally and physically with other people. Then we have loss of trust, loss of danger cues. I'll touch on that a little bit as well. And then just kind of a general loss. I can get to the place where I see the world as an unsafe place. So these are all things that we want to be aware of and be understanding of if someone is experiencing this, because they're viewing the world in a very different way when they're in this, and intervene on these areas and see how we can recover. Okay. So here is a bit, I was mentioning a little bit about this kind of loss of, let me see, what did I have here? Loss of danger cues. So these are the primary impacts of the brain that are impacted by trauma here. So the amygdala is in here, close to your brainstem. And the amygdala, one of the functions of the amygdala is it attunes to danger in the environment. So this is great, right? This is something that helps us survive and know when there's danger, sense when there's danger, and know how to respond to it. After trauma, the amygdala can become heightened, kind of goes in overdrive. And so that's what leads to some of the hypervigilance and like strong emotional reactions that we have to people, places, or things that like remind us of trauma or feel unsafe, feel threatening. We may or may not be aware of that. I think that's really important. Like we could see someone or something and have a really intense reaction, or you might see this happening in your teen and you're like, why are they reacting that way? And they may even not know themselves, but their amygdala is kind of responding in this way, and it's creating like an emotional and behavioral reaction to something or someone. The hippocampus, which is also in here, in the center part, is involved in learning and memory. So children and teens who experience trauma can have difficulty retaining information. So when they see like difficulty concentrating, difficulty focusing in school, and that's where I say sometimes, like, we miss it and we say, oh, they must have ADHD, or maybe they already do have ADHD, so that must be what's going on. Also difficulty retaining information about how to tell if a situation is safe or dangerous. So when it said on the other side, the loss of danger cues, is I basically can lose the ability to assess whether a situation is truly safe or dangerous. So we can imagine if we encounter a situation and we don't know, that feels very unsafe, right? And so what often happens is we kind of say, to protect ourselves, we say, well, that must be dangerous, right? This is, maybe I run away or I fight, right? We have the fight, flight, freeze here. And it's not actually dangerous, but my brain is a little confused and I don't know how to respond to things. So that's something that we see with trauma as well. And then the prefrontal cortex is involved in learning and thinking and planning, judgment, things like that. This is actually still developing in the teenage brain. But when trauma kind of impacts the brain, what happens is that those higher level functions like the prefrontal cortex shut down so that we can focus our energy on surviving and assessing danger. And so this limbic system, the amygdala and the hippocampus, kind of take over and the prefrontal cortex goes offline. So we really find ourselves in this constant fight, freeze mode. You may have heard that before. And when we're in that mode, a lot of stress hormones are also released, and that can have a really strong impact, like on our physical functioning as well. It can weaken our immune system and things like that. So everything's connected, right? The brain, the body, our emotions, our kind of like core sense of who we are. All of these things are interconnected and can be impacted. So this might be feeling a little dreary right now. So we're going to get into what can we do to heal. Oh, before we do that, so some challenges for parents and caregivers, okay? So these are some of the things that I've often heard that come up a lot. So not knowing what to do, of course, as a parent or a caregiver, we want to know how to help our kids. And so that's really tough when we feel like, I don't know what to do. I don't know how to talk about this. I don't know how to help. Also, like, my teen won't talk about it, right? Again, don't take that personally. That's part of the trauma itself. And then I think some more complex challenges that can come up is like, maybe I experienced the same thing and I haven't dealt with it. So I'm now being confronted with that, and I don't know what to do now that my teen is experiencing something similar. Another big challenge is I don't know if I believe my teen. This is a tough one, and if you're experiencing this, I really encourage you to get like your own support and work through this with maybe a therapist. This is really tough, and I will tell you from experience that teens very rarely lie about trauma. They don't really have any good reason to do that. It's not something that most people desire. And so if you're experiencing that and you're really struggling with it and it's getting in the way of you helping your teen, definitely I would encourage you to be courageous and do some work around that. Also feelings of like guilt or shame. How could this have happened? I was so careful. I've worked so hard to protect my teen. This can definitely come up and really, speaks to parents' concern and care for their children. and at the same time can really get in the way of helping your teen heal. So I just want to put these out there so that, if you are experiencing these things, you're not alone. These are things that many parents have said and experienced before you. So now we're going to talk about what we can do. So here's some things that we can do. So first and foremost, safety always comes first. This is our number one priority in treating teens at Evolve. This should be the number one priority of any therapist you talk to. And this is always the first priority when we talk about like healing trauma and dealing with things at home as well. So focus on safety. Anything we can do to increase safety, there's some ideas here, is going to be beneficial and kind of increase that protective element. When possible, if we know what has occurred, we want to help make sense of that. We want to help bring facts. Often when traumas have happened, there's a lot of like emotions and ideas and interpretations of what's happened that may or may not be accurate. And so sharing facts, using like videos, books, articles, things like that can be helpful, and correct or clarify like when you notice that the facts are not right. This can kind of help lay down the tracks for just kind of for the brain to more accurately process what's occurred. Open communication. And this can be challenging, of course, as we've been over, but asking open questions and really listening, like, putting away distractions, making sure that, you're taking a moment, getting yourself centered, that you're in a place where you can listen to your teen, that you can kind of be open to what they're going to share with you without expectations, and asking them questions about what they've experienced if they are willing, able, ready to talk. It's really important to be mindful of not judging their responses. There's no right or wrong. And just listening and trying to connect and validate what they've experienced. And sometimes using everyday opportunities for conversations, like that's sometimes and often when these things are going to come up, like children and teens are very rare. I mean, teens maybe a little more, but are rarely, I would say, going to be like, okay, mom or dad, like, let's sit down. I need to talk, right? Often it's more in like an everyday situation. And so it's important to both keep our eyes and ears open for those situations when maybe your teen is attempting to connect with you, as well as you can try to use those situations to just have conversations and connect with your teen. As I mentioned, providing validation and also helping like ground your teen in those interactions is going to be immensely helpful to increase that sense of safety and support. So this means like listening, really listening, not listening to respond, giving time and space to that, being patient, not pressuring your teen to talk or remember certain things or, go into more than they want to go into, but just kind of being there, acknowledging their feelings and perspective, even if it's different than your own. And increase reassurance whenever you can, and help them see that they are safe, that there is safety. As I mentioned earlier, like the structure and routine, so that can be really helpful. Encouraging play, relaxation, and self-care for your teen, also for yourself. If your teen is going through this, you're going through it too. It's painful. So it's important to take care of yourself. And if your teen sees you doing that or your family doing that, then they're more likely to get on board and model those same behaviors. Support your teen in developing coping skills, build your own too. This is like what we call parallel process, right? And if your teen is in treatment, if they're in treatment with Evolve, they're learning a lot of skills, a lot of DBT skills, coping skills. So learn those too, so that you can support them. You can know when to use them, how to use them. You can do them together. You can use your own. Sometimes when we've experienced traumatic events, kind of getting involved in kind of like more collective healing can be helpful. So this is the be part of the solution. So whatever that may, look like for you, maybe it's, getting involved in an organization, dealing with community violence, or for example, myself, I'm involved in like the National Suicide Prevention Organization and things like that. So, and then of course, reaching out for help, right? As I mentioned, it's really difficult to go through this. Your teen is going through this, or your family is going through trauma. And so hopefully this presentation helps give you some information of kind of knowing what to look for, feeling a little more empowered, and knowing like when you or your team may need more help, using the resources that are available to you. And of course, like if you are working with a therapist or a program, or you're working with Evolve, like communicate with those providers so that you can really work together as a team. Okay. And then specifically looking at treatment interventions. So like if you are in treatment, or you or your teen, or you're thinking about treatment, if it may be helpful, I'll speak a little bit to that. There's many at this point. There are like many different treatment interventions that have been developed for both preventing and treating trauma. And these have been developed for many different settings. So like individual treatment, group treatment, schools, community groups, family, all of this. I'm just going to we're not even going to get into details really with these, but these are some of the main ones. So cognitive behavior therapy, exposure therapy, EMDR, eye movement desensitization and reprocessing, very complex name. Most people just call it EMDR, and medication treatment as well can be helpful. So sometimes these things happen in conjunction as well. Okay. And then what I would like to speak about a little more is like how we do this at Evolve. Okay. So as I mentioned earlier, safety always comes first. So safety is the number one priority. And so often if a teen is coming to our residential treatment center for therapy, they have been presenting with some sort of life-threatening behaviors. And so what residential treatment does is we provide a safe, structured, secure, 24/7 environment to stabilize these life-threatening behaviors. So these are things like suicide, self-harm, substance abuse, and other kind of what we call maladaptive forms of coping with trauma. These have often been attempts, as we discussed earlier, to deal with what one is feeling. And yet those attempts of dealing with it have often created more pain and suffering and have made things worse and may be threatening my life. So this is very serious if we're at this point. And that's what residential treatment provides, is the safe environment, we're monitoring those behaviors, we're extinguishing those behaviors, and we're replacing them with new coping skills. We're doing a lot of teaching, a lot of skills development. So we've kind of addressed 1, 2, and then skills development 3. So in DBT, dialectical behavior therapy, we teach mindfulness, emotion regulation, stress tolerance, and interpersonal effectiveness skills. This kind of covers a lot of different areas to cope more effectively with trauma reminders, symptoms, interpersonal problems, and other distress, right? So this is not just for trauma, but can certainly relate very well to the trauma symptoms that we talked about. We also provide Seeking Safety group, which is a trauma-focused group intervention focused on PTSD and substance use and other unsafe behaviors. And that group provides psychoeducation, talks a lot about the importance of safety and developing safe coping skills. So it's really like, again, addressing that safety as the first step before we do any processing or talking about or working through the trauma. And then once teens have addressed these life-threatening behaviors and have established an increased sense of safety, then often the PHP and IOP treatment provides an opportunity for like more follow-up and in-depth work related to the trauma. At this point as well, if a teen is coming down from residential treatment, then they've returned to home, they're back in the home and community setting, which provides a lot of opportunities to use those skills now in real life settings and problem solve as things come up. Your teen might not need residential treatment, and that IOP or PHP may still be helpful to them. So that like looks different for everybody, but just to kind of get an idea of what this looks like. I really like this quote too. Trauma creates change that you don't choose. We don't choose to experience trauma, but healing creates change that you do choose. Okay. These are some resources, and this webinar is going to be recorded and posted on our website along with the slides, I believe. So you can access these resources later on. Also on our website, we do have some good articles and discussion on trauma as well. Okay, so I just want to put this information up here. If anyone has further information about Evolve, there's a phone number and a general email here that you can contact if you have questions about our programs or resources. Next month, our workshop will be on understanding borderline personality disorder in teens. So actually there was a question about BPD. This would probably be a great workshop for you to attend. You can register through our website, and it's going to be on May 26th. And I think that's all. Thank you, everybody, for joining us this evening.